I received an invite to come see sort of a mock-up of it at the Center for Innovation, and didn't know a whole lot about it, but it sounded intriguing. I understood that it was targeted towards reducing falls, and unfortunately I have the pleasure of often having a unit with the highest falls rate.
I worked here at Mission before we had the virtual sitter, and during those times the bed alarm would go off, we'd go in, half the time the patient would already be on the floor.
So that's what we honed in on, right? So the technology has multiple capabilities, but when we saw the capabilities and the functionality of what it could deliver from observing patients, it became very clear to the clinical staff that this could be used for falls.
Well, I think the challenge is that so many of our patients are a high fall risk, whether it's because of physical limitations or inability to follow or remember instructions. And unfortunately, the nurse or the CNA or any care member cannot be in the room at all times. And this was a way to place a caregiver basically at the bedside through the video.
So as a nurse working on the floor, caring for 4 to 5 different patients at a time, knowing that there's that extra set of eyes on our patient allows me as a nurse to really have that feeling that my other patient is being watched.
We've had a huge support from leadership, which again, this project wouldn't have happened without leadership support. We've had support from the staffing pool. They have provided the people to watch the monitoring system, and they've been very gracious in providing 24/7 support.
I work with the staffing pool, and the staffing pool has kind of been like a core team for the patient observer. We have a set number of CNAs that do this on a daily basis.
I think this is the first time that Mission has ever worked with Cerner from the ground up on something that has never been created before.
It's starting this dialogue, this discussion about how can we keep patients safer with technology that kind of helps us with the bigger aim here at Mission.
The technology and the ability to be on a project where we developed from the ground up, I've never had that opportunity, but it's been a whole lot of fun.
Not only looking at it from a clinical side, but if it was a family member, I would most definitely be interested in having this put up in my parents' room.